I call the Honourable Kwisita Sam Lotu-Iiga.
Well, thank you, Mr. Speaker, and it's a sad time to stand up here in the House, but it is important to show concern and not play politics like that member opposite who time and time again comes into this House to play politics with the lives of New Zealanders. And we know, sir, that there are 12,000 people in Havelock North that are going through some serious health concerns. We know, sir, that 2,000 of those have been affected directly by this contamination in the water system. And we know, sir, that the Hastings District Council is doing their best to address this matter, and that the District Health Board, as well as the Ministry of Health and other government agencies, are doing the best to support what is going on in Havelock North today. But sir, now is not the time for recriminations. Now is not the time to point the finger. Now is the time to say, what can we do to assist those that need help, that need health care services, those that need assistance with their ailments, and that is what is being done in the Hawke's Bay today, sir. So we know, Mr. Speaker, that this time last week, that routine water monitoring occurred in Havelock North, sir. And on Thursday of last week, samples were taken from the Hastings District Council, from the Havelock North and the Flaxmere area, and the results of those, sir, showed some contamination in the reticulation. We also know that by Friday, the council confirmed the contamination and made the District Health Board aware, the public health unit in the District Health Board, and then they, that day, fluoridated the water, that day issued notices around, chlorinated the water and issued notices around boiling water. Sir, and since then, we know that 2,000 local residents, sadly, have been afflicted. And it is our imperative, sir, this government, to work alongside the District Health Board and work alongside the health authorities in the area to get those people right. And I find it interesting, sir, that the member opposite comes in here and plays politics with this. And if she really thought that it was important, why didn't she ask a question during question time today? Why? Why did members opposite not raise a question in question time today that outlined what their concerns about this matter? Why have they not issued a press statement around this? Why have they not asked a question? But sir, it is about providing support, and I have been in several conversations with the Mayor of Hastings District Council and informing me and informing the government of progress in the area. I've also had conversations with the local member who's working hard in the area, and that is the Honourable Craig Foss, listening to constituents and doing the best that they can locally in terms of providing the services that they need. Over the weekend, of course, public information was released by the Hastings District Council, and as the member opposite has said, there is door knocking going on in order to isolate or find those members in the community that need health services, sir. And only today have the latest tests been released in terms of the contamination, and the District Health Board are overseeing the resources in the area. I understand district health nurses have been brought in from other areas. Schools have been closed as a precaution, and kids are at home. And we know that there is much to be done in the days ahead in terms of what the local district council and the District Health Board need to do in terms of the chlorination as well as the treatment of those the local water plant. Sir, mention has been made about an inquiry, and certainly the Hastings District Council have indicated that an independent inquiry will be made, will be done, and that potentially a a retired High Court judge may be seconded in to oversee that inquiry. The Ministry of Health have assured me that they will work alongside the District Council, and in order to bring about, to ask the right questions, to probe into what went wrong, how did it go wrong, when did it go wrong, and what can be done to fix the issue that is at hand. And secondly, sir, I think it's important to give trust and confidence to the water system in the area, that we analyse what can be done in the future in order for this thing not to happen again. I understand the District Health Board, sir, have activated an incident-based management team, and that happened on Friday. And the Ministry of Health have sent expertise up to Hastings. They've sent communications people, an engineer, as well as other staff who may provide assistance and support where and when it is required, sir. Sir, we know the figures that 22 people have been hospitalised. We know that 2,000 people have been affected. And, just to lend our support and our thoughts and, and our prayers to those people that have been affected. And we hope, sir, that the health authorities are able to deal with these matters in due course. We know, sir, that aged care residential facilities, the rest homes, have been inspected. We have health officials in there, medical practitioners, to ensure that the elderly can be looked after in the appropriate way. Sir, we know that the hospital activity, we've been informed by the District Health Board that they are managing with good bed availability across all the respective services in the Hawke's Bay. And we also know that they have engaged with a neighbouring District Health Board in order to identify ways in which staffing support can be put in place in order for the proper services and the appropriate services to meet the needs of our local people. So other organisations, for example, like St John's, have responded to calls, and we also know that they are supporting in a way with rostered additional staff that are on duty in the area in order to cater for the growing demands of local residents. So the Healthline has taken extra calls regarding these gastro issues, and we know that these calls are being fielded, and that health advice and health information is being communicated across the telephone lines. But we certainly know that much more needs to be done, and that's why our government is assisting in whatever way we can with the District Council, who have taken, by the way, full responsibility for this. They have made a public apology, and they are working alongside the District Health Board to ensure the health needs of local people are being met. Sir, no one likes to see this situation occur, particularly in our country where our fellow citizens are experiencing these very terrible health ailments. But we know that once it's happened, we know that we need to do something about it, and that's why the District Health Board are working and committed to dealing with these health needs as they arise. Sir, our government stands alongside those people in the Hawke's Bay. We know that there is much to do. We know that an inquiry will follow, but right now, the most important thing that needs to be done is to deal with the health issues of those that present to GP clinics, to the hospitals, and in terms of the online help that is being given. So we know that we will be continue to work alongside the District Council and the Health Board to meet those needs.
Mr. Speaker.
I call Kevin Haig.